Hello and welcome to week 5 of medical terminology class. This week we're going to be talking about the muscle system or the muscular system. Very exciting. You don't even know things about this system. Did you know that there are more than 640 individually named muscles? And then there are a whole bunch more that don't have individual names. The longest muscle is the sartorius muscle, aka the thigh muscle. And the smallest muscle is the stapedius muscle, which is in your middle ear. Now, to give you an idea of comparison, the sartorius muscle is about 12 inches long in the average person, human adult. And the stapedius muscle in the middle ear is only about 1 millimeter in length. That's quite a big difference, huh? And the stapedius muscle in the middle ear stabilizes the stapes, which you may remember from when we discussed the skeletal system last week. The largest muscle, now this is interesting because the longest muscle is not the same as the largest muscle. The largest muscle is the gluteus maximus, which is the outermost muscle of the human buttocks. That's your hiney, okay? The strongest muscle, see, some people think it's their arms, maybe their legs. Nuh-uh. It's their masseters. These are the muscles that are used for chewing. Isn't that interesting? And the busiest muscles in the entire adult human body are the optic muscles, the muscles in the eye, which move over 100,000 times a day. And just to add a little extra to this is there are 30 facial muscles, 30 facial muscles that are used to create looks of happiness, sadness, or surprise. Isn't that amazing? 17 facial muscles are used to smile, and 42 facial muscles are used to frown. So there's another reason why you should be smiling instead of frowning. Okay. All right. Those are just some cool factoids that I think are nice to know. It's a lot more interesting than this muscle does that and that muscle does this, like you learned in anatomy class. But now we're going to focus on the names because this is medical terminology class. Okay. So there are muscles that are grouped by size. And here are your medical terms: vastus, meaning huge. And that's easy to remember because you could think of something that is vast. Vastus are huge muscles like the aforementioned thigh muscle. Maximus, which means large, like the gluteus maximus. Longus, meaning long, like the difference between that thigh muscle that's 12 inches long and that stapedius muscle that's 1 millimeter. Minimus, which is small. And then brevis. And that's easy to remember for short, because if you think about brief, if this was brief, it would be short. So brevis, short. Okay. Some muscles are grouped by their shape, because they're not all long and thin, okay? So deltoid is a triangular muscle. You know how guys who work out, maybe women work out too, and work on their delts? Rhomboid, like a rhombus with equal and parallel sides, okay? Lastimus, which is wide. Teres, round. Trapezius, like the trapezoid, only a 4-sided figure with 2 sides parallel. Like that. Okay. They can also be grouped by the direction of fibers. So we have rectus, which is straight, transverse, which is across. Do you remember we talked about transverse being across? I want to say it was in week 1 or week 2, where we talked about the medical terms that identify a direction. Okay. Oblique, which is diagonal. We also learned about that. And orbicularis, which is circular. Now, you might wonder, what I have circular muscles in my body? Yes, you do. They are also called sphincters, which are round. There are something like 32 sphincters in your body that open and close, and those are muscles, orbicularis muscles to be precise. All right, the location. So we have pectoralis, which is a chest muscle. Gluteus, which is the buttocks or the rump or the hiney. Brachii, and you know that, right? Brachii in the arm. Supra, above. Infra, below. Sub, under or beneath. And lateralis, lateral. Okay, and these terms should begin to be familiar to you because you have heard them before, not only in this series of live chats, but because these terms are also married in a fashion to anatomy and physiology aspects. Okay, so you see you have that crossover, and that's a good thing because it shows you that medical terminology is working to be consistent across the board. Not always, but pretty much. You know, it's just like English. We have a thesaurus that gives us 25 other words that kind of sort of mean the same thing as the word we started with. So what language? They didn't invite me to the meeting. I would have put a stop to it, but no. Anyway, all right. So there are more muscle groups. The number of origins, which is the origin is the point where the muscle begins. And then you have the insertion point, which is the other end of the attachment, okay? So the number of origins, you might have your biceps. Remember, bi meaning 2. Triceps, tri meaning 3. And quadriceps, 4. All right? And if any of you all work out, these terms again should be familiar to you because these muscles tend to be the focus of a lot of exercise routines. Okay, then we have origin and insertion, and these are the muscles that don't have their own name, like the sartorius muscle. Instead, these muscles are named for their origin and their insertion points. So we have the sterno, remember the sternum, clito, which is your clavicle, and then the mastoid, which is your jaw. Us. Sternocleidomastoideus is the origin on the sternum and the clavicle, right here. You know where you have this little indentation? That's right where they join. And the insertion is on the mastoid at the jaw. And when you look at an illustration of the muscles of the neck, you will see it. That goes that way, but it goes this way. Okay. Then we also have the branchioradialis, which is the origin on the brachium of the arm and the insertion on the radius. Now you remember the 2 bones between the elbow and the wrist are the ulna and the radius. So the radius is the insertion point for this particular muscle. Okay. And then you have action terms. Action. All right. So these muscles are a general grouping of muscles named so for what they do. I'm sorry. Oliver is speaking to someone else in the house. Okay. The abductor, to bring it forward toward the body, the adductor, away, flexor, flex, extensor, extend. See, I did that action movie, but I'm not a violent person. Extend, to pick up a glass. Okay. Levitator, to lift or elevate a structure. So if you are going to like pick your leg up at the knee to take a step. And then the masseter, which is your chewing muscles, which are right here, which we already talked about, right? Remember that? The masseters, the strongest muscles in the entire human body. Out of 200 and, no, that's bones. Out of over 640 muscles, the strongest, right here. All right. So the medical specialty that is focused on the treatment, the study and the treatment of the musculoskeletal system. And often you will hear these two systems. Remember, last week you learned about the skeletal system, which are the bones. This week you're learning about the muscles, but very often they are combined to the musculoskeletal system because the skeleton is of no use without the muscles, right? Think about a skeleton. It can't do anything. It just hangs there. As a matter of fact, without the muscles, a lot of the bones would just fall away because the muscles are the connectors in addition to the action-oriented portion of the body. And the spine, the joint, and the muscles. Okay, so orthopedic physicians focus on the correction of disorders and deformities related to the musculoskeletal system, because in treating a patient, it's almost impossible to separate the care of the muscles from the care of the bones because they are so integral to each other. Does that make sense? All right. Here are just a few, and could you believe that? These are just a few of the muscles in the adult human body. Oliver. Sorry. Okay. And you will notice that some of them are directly related to bones that you learned about last week, like the clavicle. Okay. Some of them are named for how they work or shaped, like the trapezius or the deltoid. And some of them are named for their origin and insertion points, like the sternocleidomastoid muscle. Now, as a healthcare professional, you are going to have to memorize all of these muscles and their names. I'm kidding. Okay, no. We're coders. We don't memorize anything. If you were to go work in or work with an orthopedist, you would learn this from the repetition, okay? But it's important that you understand in medical terminology class, it's important that you understand where the names come from so that you can start to sew this body together, okay? All right. So in the body, there are only 3 types of muscles, and this is important for you to understand. A skeletal muscle, for the most part, enables movement. These muscles are the proactive part of the human body, and for the most part, not completely, but for the most part, these muscles work with your intention. Okay, and what I mean by that is if you want to make a facial expression, if you want to move your eyes, if you want to go pick up that glass of water, that is an intentional movement, and you will be using your skeletal muscles to do that. But I said not completely because you'll notice that they are also involved with respiration. And respiration and the muscles that help you breathe in and breathe out. And if you've ever done meditation or yoga, or again, exercising, breathe in and breathe out. You know, you use your diaphragm to do that. That would be intentional, but there's also an aspect to respiration that is part of the autonomic nervous system, which works without you thinking about it, without conscious thought, which is a good thing. Could you imagine if you had to sit there all day and go, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out? You wouldn't be able to get anything else done. So the good news is the autonomic nervous system tells the muscles contract and release, contract and release. The smooth muscles are involuntary muscles, which again is very good. They are within the walls of the blood vessels and the viscera, inside your inside your vascular system, and that's what continues to push the blood through your body, is the slight contraction and release of the blood vessels. And those are your smooth muscles working, again, without conscious thought, because again, if you had to do that, you wouldn't get anything else done. And then we have this specialized group of muscles called the cardiac muscles, and they are solely in charge of causing the heart to contract and expand properly. This is very, very important. And you may have heard the term myocardial. Okay, M-Y-O is the prefix that means muscle, and cardio is the heart, cardiac. So that refers to the muscles that work on the heart, again, involuntary, part of the autonomic nervous system. And that's part of the incredible way that the human body works, is the nervous system has to tell the muscles to contract and expand, contract and expand. And this is why sometimes it can be so difficult to diagnose appropriately or even treat some conditions, because, for example, if the heart was not contracting and expanding properly, just from what we've discussed here, this could be a neurological issue or it could be a muscular issue. And so the doctor has to investigate to find out, is it the autonomic nervous system that's not telling the muscles what to do? Or is the nervous system telling the muscles what to do and they're just not doing it? We have to find that out first before we can even look to fix it. So this is part of the important thing that you're learning as you learn what things are called, because, as you can tell, the different systems of the body work together. And it's amazing what it accomplishes, right? No matter how many times I go over the construction of the human body, I am totally amazed. All right, so remember, keep your foundation strong, review often. That is the best way to get these terms and their meanings sticking in your head. Okay, use your medical dictionary. It's not cheating. It's working smarter, not harder. And query. All you have to do is send me an email. It doesn't matter. It's not silly. It's not stupid. I will tell you right now, those students who ask questions when they're uncertain or they want a clarification or just to talk it through, whatever, are the A students. Those are the students that succeed because you are learning. And that's the name of this game. Okay. Also, I want to let you know that this just is recent. You now have a tutor available. If you prefer extra help, you can come to me always. But now we have a dedicated medical terminology tutor who offers you one-on-one sessions on Wednesdays from 6 to 9 p.m. You want to email Monisha for an appointment so you can get that slot. Okay. And again, smarter, not harder. All right. Do you have any questions, comments, complaints, curiosities? I'm running out of C words. Anything? No? I can't hear you.
I did have a problem about something, but I think I'll just email you about it because it's just saying some of my work wasn't turned in, but it was graded.
Okay. Email me and I'll check it out. Sometimes, you know, the two systems don't talk to each other, you know, Connect and D2L. And so just email me so I have the details and I can look into it more effectively. Okay. No problem. All righty. Have a great day. Stay safe. Keep studying.